closer to the athletes, coaches, families, and fans of Cincinnati sports. It's On the Sidelines with Q102's Molly Watson and Lindsay Patterson. Presented by OrthoCincy, the orthopedic authority.
We are on the sidelines once again this week with an amazing doctor from OrthoCincy, Orthopaedics and Sports Medicine. Welcome to the show, Dr. Wilkes.
Thanks so much for having me. Appreciate it.
Hello. Hi. So what exactly do you do at OrthoCincy?
Oh, well, thanks for asking. So OrthoCincy, we're a large private practice offering kind of comprehensive orthopedic services. Myself personally, I'm a fellowship-trained sports and shoulder doctor. So within our practice, we try to with the right physician to give them their specialty services.
Okay. And why did you pick that?
Oh, yeah.
I'm always curious, because we've talked to doctors who work on ankles, feet, there's so many different options, hips. Why did you pick
Yeah,
that?
Absolutely. Well, I love orthopedics, first of all, as it's a really wonderful way to fix a problem. We get to be one of the few specialties that can actually take a problem and fix it. Within orthopedics, I played a sport in college. I enjoyed sports. So that drove me down the sports path. And then particularly even within that, I just love the complexity of the shoulder specifically. So that's kind of how I got where I am.
Okay, interesting. And I know we have a lot to discuss. We have, unfortunately, a laundry list of injuries here. We're dealing with the Reds ahead of opening day. And Lindsay, I'm going to let you start with a few questions we have.
Yeah, this offseason was all about bringing in the depth, and the biggest thing for any team, you can look at the NFL, Major League Baseball, and for the Cincinnati Reds locally, you want to stay healthy. That's going to be the biggest thing. And you have this young roster. And unfortunately, getting news before we recorded, actually timely, Matt McLain, the Reds announced that he is going to have surgery, or he had surgery yesterday to address the cartilage damage and repair the labrum. What does that timeline look like for Matt when it comes to maybe returning this season for the Reds?
Yeah, great question. And really unfortunate for such a promising player, right? Well, obviously this is breaking news, so we don't know a lot of the details yet. If we're fortunate, the rehab and recovery for labral surgery typically runs in the neighborhood of 4.5 to 6 months. So it's usually reasonably intense. Mm-hmm. I think we have the benefit of it being his non-throwing shoulder. Mm-hmm. And so I think that could really play into our benefit and maybe put him on the faster end of that spectrum.
Are there different degrees? Because we don't have a lot of information, and we probably won't get that information, more of the overall timeline of when he starts to return, and maybe we can kind of assume what it really was and how torn it was. But are there just different degrees that we can hopefully be optimistic about?
Yeah, absolutely. And from what I've heard, I think we can be optimistic, I believe, for Matt. But the labrum is a little rim of cartilage that goes around the socket of your shoulder. You can think about your shoulder a bit like a golf ball on a golf tee, and the labrum is a rim of cartilage around the golf tee. It actually comes from the Latin word for a lip that way. Sometimes if the shoulder actually dislocates or comes out of place, that can lead to a pretty significant labral tear. And so hopefully that's not the case. Other cases where the labrum is torn and painful but not associated with the ball coming out of the socket can be a little less serious and faster to heal.
What does rehab look like for him?
Yeah, in the short run, just as similar for a lot of orthopedic surgeries, there's some degree of resting the area to let things heal. So in the short run, he may be in a sling, he may be working on his elbow, hand, his shoulder blade, but resting the actual ball and socket. Then after a certain amount of time has elapsed, he'll be in with a therapist doing rehab to get his range of movement back. And then sort of the second and third tier goals start to be activating his muscles, getting his coordination and stability back. And then the final tier is baseball-specific activities. So swinging a bat, it's his glove hand, so getting his glove where it needs to be, those kind of things.
Are there any other Major League Baseball players that you can think of that have kind of gone through this and their timeline is probably similar to what we're looking at with him? Yeah,
it's a really common injury for baseball. Of course, it's such a shoulder intensive sport. Again, I think the big thing that Matt has going for him is it's his non-throwing shoulder. Yeah. The throwing motion is baseball is such a challenging movement on your shoulder that it introduces a whole nother level of challenges. But yeah, it is a common injury. And again, I think 4.5 months might be something we could kind of put in our mind as Reds fans to mark the calendar and cross our fingers.
Maybe when they're making that late July or early August push for the NL Central, he returns. And another question I actually had a follow-up to that. When it comes to the strength of obviously rehabbing, say it does take about 4.5 months for him to come back. Is it hard, even though it is the non-throwing hand, is it hard to gain that strength back through rehab?
It is, yes. Certainly, you begin losing strength really quickly. So some research shows within 3 weeks, you start meaningful muscle and strength loss after an injury. So if you think about that immobilization in the sling and the time where you're not doing much, you start losing that strength really quickly, and it's hard to get back. That said, athletes these days have the benefit of amazing physical therapists, great trainers, and things to try to counteract that. But I would say it's especially for professional athletes who function at the top 2% of human performance, that kind of muscle strength coordination is the hardest thing to get back.
Before we got the Matt news a couple weeks ago, I know the Reds were announcing, at least David Bell talked to the media, and he said, TJ Friedl, look, timeline to be determined. It could be a few weeks, still optimistic. He had the non-displaced right wrist fracture that happened on March 16th spring training game. What is a non-displaced fracture?
Yeah, a good question. Yeah, so everyone knows a fracture is just a fancy word for a broken bone. A non-displaced fracture, you could imagine in your head like a crack. Imagine that a rock hits your windshield and you see these little tiny cracks, but your windshield's still intact and it's working as a windshield. That's sort of a mental picture you can take of a non-displaced fracture.
Spring brings new beginnings, but it can also bring unexpected injuries. OrthoCincy's orthopedic urgent care is more affordable than a busy ER. With 5 convenient locations, including extended evening and Saturday hours in Edgewood and Anderson. OrthoCincy's orthopedic urgent care makes it easy to get the care you need. Simply walk in, no appointment necessary. Visit orthocincy.com to learn more. That's orthocincy.com.
And as far as a wrist injury, oh my goodness, we talk about that plenty with quarterback Joe Burrow. How does this compare to other wrist injuries, fractures, torn ligaments, etc.?
Yeah, good question. So, it was my understanding that the initial x-rays were normal, and that's a really good indicator. It took an MRI to pick up on the bleeding and swelling within the bone, and that tells us that it's a little more of a subtle fracture. To the point of your question, which is really good, of course, no one wants to break a bone, but there's an adage in sports medicine. It's often better to break the bone than it is to hurt the ligaments or tendons, a la Joe Burrow, unfortunately. And so the prognosis is better in this situation.
Yeah, I've heard that a lot over the last few months that, maybe the fracture is better than the ligament. So we're hopeful there for TJ. But just a few more follow-ups to kind of what he's dealing with right now. With the initial x-rays, they were showing negative. Why would they show negative to begin with? Yeah,
sometimes that fracture, if you'll take that kind of crack analogy with the windshield, it's so subtle that you can't pick up on it on the sort of the pixelation or the level that you can see on an x-ray. MRIs, they work on magnetism, and they let us see fluid bleeding in the bone, and so are more sensitive. So bone bruises, these kind of microfractures we call them, sometimes they take an MRI to pick up on that.
How do they decide if surgery is necessary or not?
So typically that's based upon the amount of displacement. Very rarely would a non-displaced fracture or a bone bruise need surgery. It gets a little more nuanced when you get into displaced fractures, as you're always weighing the benefits of the surgery to put things back in place with the risks or the damage that the surgery might cause. And that's when the judgment of the surgeon and taking into account patient-specific factors really comes into play.
What does that timeline recovery look like for him?
Mm-hmm. So it's good for TJ, thankfully. The non-displaced fractures heal really well. The wrist has got a great blood supply and heals quickly. So 6 weeks would be a good number that you could put on it. The other issue that's good for TJ is with it being a non-displaced fracture, he is probably free to be doing a lot of strength and conditioning, staying in shape, so that once the bone is healed, hopefully he'll be close to his previous self.
Some good news. We're liking this.
Yeah.
I feel like I was holding my breath through all of that. But bone bruising to me just sounds really, is that pretty painful? Is it, I mean, it sounds awful to me.
It can be pretty painful.
It can be pretty bad.
Anybody in your audience who's broken a bone knows there's a pretty rich network of nerves in your bones, so they're pretty painful.
Okay. And I'm curious, too. So I sprained my ankle back in the fall, and thank you to OrthoCincy's, Orthopaedics and Sports Medicine for taking care of me. But ankle and foot pain, to me, was unlike anything I've ever experienced. Is it the same when it comes to the shoulder and the wrist? Or is it, what's the pain?
Similar.
Is it pretty similar?
Yeah,
okay,
well,
I've heard.
First of all, I'm sorry you went through that.
That was
Sounds
awful.
unpleasant. Yeah.
Yes.
Foot and ankle issues are kind of their own beast, as we take for granted every day all the weight and pressure we put through our foot and ankle. It's amazing they hold up as they do. So when you have problems there, oh my goodness, it's such an impediment to your life and your mobility. It's tough.
It is.
It's a different set of problems in the upper extremity. So, your wrist, elbow, shoulder. You don't lose your mobility so much. So that's better. But shoulders particularly are pretty notorious for being painful. Sprains, they get knocked as, minor injury, but it can be pretty painful.
It can be pretty bad. So another player dealing with some issues here, shoulder soreness, his left throwing shoulder. We're talking about Brandon Williamson. This just happened a few days ago, March 17th. He was only 2 innings in, and he came off the field complaining about some pain there. So what are the possibilities? Could this simply be a tired arm? What's the explanation here?
Yeah, this is a great question, and I know it's a lot of Reds fans hated to see him come out of that start, and were instantly worried. Early in the season, it's incredibly common for pitchers to struggle with shoulder soreness. I think that the problems are really numerous, so it's hard to put a finger on it. Oftentimes, the pitchers' off-season programs don't match the intensity of getting into a competitive environment and throwing hard, having your adrenaline pumping. Oftentimes, pitchers are trying to work in a new pitch, a new delivery. This may be a new kind of stress or strain on their shoulder. So, some combination of the intensity, new techniques, early season sort of coldness, if you will. But I know it's hard to say right now, but we all have our fingers crossed. It was just a sore, tired shoulder, and the staff are being careful.
Okay, because it says they're actually doing aggressive treatment. What does that mean? That doesn't sound careful.
Yeah, I guess meant careful by protecting his innings, and his pitch count. That way, yes. Hopefully, I think aggressive treatment, they mean they're really working hard on him. We have so many modalities now. These are things they can do in therapy to promote blood flow, to reduce inflammation, working with therapists to keep the shoulder stretched out. Working on a strength program. Hopefully that's what they mean by aggressive treatment, and that it doesn't reflect a severity of injury, of course.
Okay. And then another one, we'll switch gears to Edwin Arroyo. He's dealing with a torn labrum on his left shoulder. Reds number 3 prospect, 67 overall according to MLB Pipeline. And he will miss the entire 2024 season. What are the usual signs of a torn shoulder labrum injury? This just sounds awful. I mean, the whole season. Mm-hmm. That's got to be pretty serious.
Yeah, unfortunate news for another really promising player. Exciting to watch. But labral symptoms can present in kind of 2 ways. One of them can be instability, sort of the feeling that the ball doesn't want to stay in the socket. Certain arm positions. Another set of symptoms we often call mechanical, things like clicking, catching, and sharp, sudden pains in certain movements. So again, unfortunately, labral tears are common in overhead and contact athletes. Mm-hmm. So it's not incredibly surprising, but unfortunate.
You just mentioned he's going to be out for the season, but earlier we're talking about Matt McLain, and obviously injuries can be different for all athletes. What is the difference between the two right now with the information we do have?
Yeah, that's a great question. Certainly, of course, as you alluded to in your question, the severity of the tears could be different. So the size of the tear, the labrum, you can actually tear it in the front, in the back, in different places. But I think one of the big differentiating factors is if you have a labral tear associated with instability or a ball that wants to come out of the socket, that's a tougher problem to fix with a longer rehab, and could reflect the length of time that they're keeping Arroyo out. Hopefully the news for McLain is more one of not having instability and that might be why the promise of an earlier rehab is on the table.
Yeah, we're really hoping for that. I know the Reds announced that today, and part of their announcement was we're hoping to have him back this season. And, the things that you just can't put timelines on until they see how the recovery and everything is going. With you offering really good information, I think it's important for Reds fans to let's see how it goes. Let's see how the process goes. Hopefully everything goes well, or everything went well with his surgery, and we'll see how rehab goes for him. But I do have one more I do want to bring up. Noelvi Marte, he was suspended for 80 games. The March 8th tested positive for one of the banned steroids in Major League Baseball. I need to ask you, what is Boldenone?
Yeah, again, tough situation here, and we wish him the best. But Boldenone is an anabolic steroid. So it is a testosterone analog, we call it. That means it's a chemical substance that looks like testosterone to your body. So it can play a lot of the roles that testosterone might play in your body for you. So doing things like promoting muscle synthesis or making muscle, promoting proteins that help you with recovery. It has been around for a while. I believe it was originally developed in the veterinary world, but it has been used in the bodybuilding culture for a while for anabolic steroids. But that's kind of what it is.
Yeah. Is it ever recommended to use in aid recovery?
So I do know of it being used kind of under the table in some circles for recovery. It's certainly not recommended, and we certainly don't ever endorse that. And of course, that's why it's on the list of banned substances. I think an important thing to talk about is just that while all those things that testosterone does, that Boldenone allows you to have, sound great, our bodies are a pretty delicate balance of hormones and chemicals, and anytime you mess with that balance, there's consequences. There's no free lunch in biology, and so when you take things, you get unfortunate side effects, and some of those can be kind of serious. So that's why it's generally not recommended for recovery.
I feel like you offered good and bad news today.
I feel like it was a lot of good, like 50%. We were a little optimistic for some, and then others, it's gonna be a little bit of a longer process. So
kind of an interesting topic. I mean, I maybe
hey,
it's just because my
head's
in academics or whatever.
Yeah.
But I think a lot of people think that you have orthopedic surgery and then it's just like you were before. Right, and it's just not true.
It's not,
It's not true because we just don't make things the way they were made.
Yeah.
And it's not true in baseball players because what you do when you throw is so like on the edge of human performance that getting back to that is like really tough. And so like what a lot of people don't know is like it's not as bad for like Arroyo and McLain, but for pitchers who have labral surgery, the rate of them throwing at the same level they were before. So for example, will you make it back to the big leagues? Mm-hmm. And will you throw with the accuracy and velocity that you used to throw? Like those rates are not amazing. 80%, 78, 77, 82, it's different studies, right?
Yeah.
But so there could be like a 1 in 6, 1 in 5 chance that you're not the same pitcher ever again. So like that's a high number.
That is
right?
a high,
And
yeah.
then people just don't realize that. They think you just had surgery, you're back. But that's not how it, especially for pitchers, that's just not how it works.
Should we be worried about Joe Burrow?
I know. I'm like, this is all connecting in my brain right now.
Well, I mean, obviously I don't do scapholunate surgery, so I don't know that literature so well.
Yeah.
But I mean, like my hand partners, they're worried about Joe Burrow.
So he is. So there was a report out today, and I'm sorry to bounce off from our Major League Baseball talk with great information, but I'm going to ask you one quick question, and we can cut this out if we don't have to put it on there.
No, put it on the
But
I like it.
So he started to lift weights, and today there were reports that he's doing light throwing now. Nothing, no 60-yarder bombs down the field, but he is throwing. What would you think about that from a December 1st surgery to where we're at right now in the end of March?
That would absolutely, I think, be a positive finding.
Yeah.
I think you've made a really good point in some of your questions that everyone's kind of journey, if you will, through rehabilitation is different, person to person. And so the fact that he's progressing along well enough that they're comfortable with him gripping a ball and they're comfortable with the movement of ball release. That's really what it is for the quarterback. Is really positive. So. As a fan myself, I take that as very positive.
Okay, good.
I'm hoping.
That's good.
I appreciate that. We love all of the updates, but no, I agree with you. I mean, that's the most important thing. I think a lot of people have to understand. Every athlete is different. Rehabs look different. Timelines look different. Recoveries look different. It's really just kind of how your body. And the good news for a lot of Major League Baseball and even on the NFL side, you're gonna have the best doctors. You're gonna have the best rehab. You're gonna have everything from the training to when you're ready to go and cleared to be healthy again. It's all gonna be good. But you bring up a really good point, just how you were ending the podcast. Just because you have surgery doesn't mean you're back to 100%. It really is all the work that you have to put in, and hopefully it's all good.
Absolutely. We often tell our patients, it really is a team sport. It's the patient and the surgeon and the therapists and the athletic trainers and the performance coaches and the mental coaches. So it really is a team effort.
All right, Dr. Wilkes, that is a wrap for today's episode. Thank you so much for joining us on the sidelines here and teaching us so many interesting things. This was a great episode. And I think, Lindsay, you feel like you can take a deep breath. You've been really stressed about it.
Every month we have our OrthoCincy's Physicians Ends. It's so amazing. I learned so much, and I have so many questions.
She does. When it comes to the injury list, she's always on top of them. So, again, Dr. Wilkes of OrthoCincy's, Orthopaedics and Sports Medicine. We will chat with you soon, hopefully, with news that everyone is doing great, right?
Yes.
Thank you. Yeah, we hope so. Thanks for having me very much. It was fun.
Thank you.